Hello guys! So recording na naman tayo. So we are here now in Section 3, Bioethical Principles and Code of Ethics of Medical Technologists. Guys, every day we decide, diba? We have the capacity to make choices. So example ng mga choices. Do I need to pass I need to pass the exam. Should I cheat or not? Doctors decides about this. I need the organs of this dying patients. Should I let him die fast? Yan. I need money of this pharmaceutical company. Class, pharmaceutical company, Moderna, AstraZeneca, yung mga gumagawa class ng mga vaccines. Nako, yumayaman sila at pabilisan sila gumawa ng vaccines. So, perhaps someone is asking themselves, shall I change the result of my research on their drug? Yan. So, class ethics is about making choices. Yan. Deciding if this is good or this is bad. But sometimes, class, there are cases wherein there are gray areas eh. Mahirap mag-decide or kaya may mga cases that the resources are scarce. So, sino ipa-prioritize natin? Ganun yung mga tanong eh. Who should we allow to die? The younger person or the older person? Diba? Yung mga ganung tanong. So, in bioethics class, there are lots of difficult decisions to make. Like issues on abortion. Yan, walang kasama-samang abortion, contraception, euthanasia. Class, who will get the dialysis machine first? In COVID-19 response, who will get the ventilator first? Class, I asked my friend, gladly here in the Philippines, she's working in NKTI and she's a resident there. So far, wala naman daw kakulangan ng ventilator. Yan. Who will get the organ first? Ayan, once it's available. Yung mga tanong na ganyan. Class, how is it to properly research on humans? Especially itong vaccine na to. IVF, cloning, genetic engineering, how doctors deal with their patients. Yan. So these are a couple of examples wherein ethics or bioethics is applied. Yan. So ethics or moral philosophy, so it is concerned with principles that allow us to make decisions about what is wrong and what is right. But sometimes, I'm telling you guys, there's a gray area eh. Hindi mo masabi kung ano yung mali talaga at ano yung tama. You just balance the consequences out. Yan. Magbibigay tayo ng examples mamaya. Bioethics is especially concerned with moral principles and decisions in the context of medical practice, policy, and research. Yan. So class, historically, there have been shady actions or gruesome actions when it comes to research. Yan. That's why we need to put ethical limits. We should apply bioethics. Kaya class, in every research that they do, it should be screened by an ethical committee. Kasi class dati, ito yung mga example ng mga nangyayari. So, itong headline na to is from history.com. So, if you have time, class, bisitahin nyo naman yung history.com and type this down. So, the father of modern gynecology performed shocking experiments on slaves. Yan. So, back then, class, they were exploiting slaves. Yan. Poor people. Here, dito rin. Number 2, the Tuskegee experiment, the infamous syphilis study. So I think by now, diba, you are acquainted with syphilis. Yan, syphilis is caused by Treponema pallidum and it's an STD. And apparently, guys, in Tuskegee, Alabama, there were lots of Negro male who had syphilis. And class, these researchers studied this Negro male, this 6,000 Negro male who has syphilis without treatment. Inobserve lang nila kung ano yung impact ng syphilis sa mga Negro male, pero class, hindi nila ginamot. Yun. So, yun yung issue dyan sa Tuskegee experiment. Pinanood ng mga researchers mag-suffer. Basically, they want to see the whole clinical picture of syphilis, kung paano yung progression niya. Yan. Apparently, class, ang pinaka-worst na effect ng syphilis is it can cause paralysis. And what's worse is you can transfer it to your baby. Yan, it can be passed through from the parent to the baby. So, pati yung next generation na apektuhan dahil sa experiment na to. And the company paid $10 million of damages, I think, to the families. Ganun. So, class, di ba, without proper ethics, yan, proper respect to human beings, class, di ba, science can go beyond its limits and harm people. Kaya, class, kailangan natin ng mga ethical principles as a guide when it comes to medical interventions and when it comes to researches. Class, these are good reads. Yan. So, if you have time, then read it. Yan. So, principles of ethics, class. So, we will discuss this main four. So, autonomy, beneficence, non-maleficence. Yan. So, di ba we have a movie of maleficence. So, yung opposite ng maleficence, non-maleficence. Totoo. Yan. Do no harm and justice. Yan. So, class, first one is autonomy. Yan, autonomy. So, autonomy is when we allow patients, when we respect the patient's capacity to decide for their own body. Yan. They will be making decisions whether they agree on a medical intervention or they do not want or refuse any medical interventions from health professionals. So, yan, class. So, autonomy is allowing a person or a patient to govern themselves, to decide for themselves. Yan. Siyempre, class, may mga exceptions sa autonomy. What if they do not really have a capacity to decide for themselves? What if they are minors? Yan. So, ang pinag-uusapan, class, here in the Philippines, a minor is less than 18 years old. So, unless you're not 18 yet, you're still a minor. But class, ang exemption is, example, in HIV testing, adolescents with 16 or 17 years old may be tested of HIV without their parents' consent. Ayan. So, I think ito yung mga bagay na kailangan iniisip, diba? So, part of autonomy. What else? Issues about euthanasia and abortion. So, class, one way of justifying abortion, yan, yung mga paano nila dyan justify ang abortion is it's pro-choice. Yan. It allows the woman to decide for herself. And since it's her body, yan, and a fetus is part of her body, so she can get rid of it if she wants to. Yan. So, yun yung mga pinaglalaban ng abortion. Pero class, mamaya, example, another principle is non-maleficence is do no harm, but it violates the ethics do no harm kasi you're harming the unborn baby. Yun, yung non-maleficence. And beneficence, yan, inaano niya rin, tawag doon, beneficence is also part of abortion issue because we want to promote the well-being of an unborn baby. Yan, parang mga ganon, class. So, in autonomy, class, abortion is justified by allowing the patient to decide for themselves. Yan. So, class, how about euthanasia? So, euthanasia is doctor-assisted suicide. Doctor-assisted suicide. Some people, class, who are really in pain, ganyan, who are really depressed, some or who have chronic diseases, yan, who are in great pain, they ought to go for euthanasia. So, ayun na magpapa-inject sila sa doctor or they want to be removed from life support, ganyan. So, autonomy is they justify their acts through autonomy. So, wherein they since it's their own body, yan, they make the decision. So, parang ganun pa rin. So, class, an important part of autonomy is informed consent. Yan. Class, no medical intervention, no medical therapy, no phlebotomy, no removal of any organ will happen unless a patient will give their informed consent, informed consent. So class, when a healthcare provider educates a patient, yan. So a healthcare provider will tell the patient, ma'am, ito po yung gagawin natin. Here are the benefits of the health procedure, here are the risks, here are the alternatives, and you will allow the patient to have a shared decision making between the doctor and the patient. Class, in informed consent, so we are trying to get the permission of the patient. Yan. So we get their permission to allow us to do any medical intervention. So ibig sabihin, hindi tayo class gumagawa ng kahit ano, hindi natin hinahawakan ng mga pasyente natin, hindi natin binibigyan ng kahit ano if without their consent. In the research class, we cannot experiment on people if they did not give their informed consent. Yan. So class, to give a consent, yan, to ask for a consent, dapat you have to give it fully. Yan. You have to explain it fully. So identify what the procedure is all about, identify the risk, yan. Ano pa ba yung mga consequence, ano ba yung benefit, yan. What are the costs. Yan. So, class, since we respect autonomy, yan, ang concept ng informed consent ay kasama under the umbrella of autonomy, ha? Informed consent. Yan. Sabi niya, to protect people from being coerced into decisions that someone else thought of, sabi niya, wherein, natatakpan ng ano, or the state's best interest. Yan. So, no matter what the state say, the government say, or no matter what the doctor say, yan, since it is your body, you have the capacity to decide or to refuse any medical therapy that you don't want to do. Ganyan. So, that's informed consent. So, it's also applicable in research, guys. Yan. So, class, but yun nga, ang autonomy natin, may limits siya. Yan, may limits siya. Ang pagkuha ng informed consent, class, may limit siya. Yan. So, your autonomy can be questionable. Yan. Your ability to decide can be questionable in cases that, yun, a patient is overwhelmed, a patient is in distress, or in trauma. Class, paano mo makukuha yung oo niya or yung hindi sa medical intervention if they are in distress, yan, or they are depressed, class. So, may mga limits rin itong mga principles na pinag-uusapan natin. So, this is a study from AMA Journal of Ethics. Yan. So, what if a patient is overwhelmed? Yan. Do we trust their informed consent? Yeah. So another term for your informed consent are self-government, self-rule, self-determination. Yan. That's why, class, we have the anti-vaxxer parents. Yan. So parents who do not allow their babies to be vaccinated. So they justify their actions because of autonomy. Yan. Since it's their baby, yan, they have the main responsibility for their baby, yan. They don't want their baby to be vaccinated, yan. And since that is true, that they are the parents of their baby and those are their baby, we don't force them because we respect their autonomy. But guys, pwede natin i-overrule ang autonomy. Kasi, what if a patient wants antibiotics for a viral infection? Diba? Isn't it that your antibiotics is for bacterial infection? Yan. Bibigyan mo na ba ng viral antibiotics ang viral infection? Diba? Kasi, do you respect autonomy enough to give them the wrong medication? Yan. What if a patient asks for renal dialysis for urinary incontinence? So, class, urinary incontinence, when you have difficulty urinating, class, alam niyo ba yung term na balisaw-saw? Or you only urinate in a short bouts of volume. Unti lang yung naiihi mo, yung balisaw-saw, class. Class, ang balisaw-saw, yan. So, renal dialysis is not a solution for balisaw-saw. Yan, renal dialysis is when when your kidney is not working anymore and it cannot filter out the harmful toxins in your body. So, class, sometimes our patient do not know what's the best for them, 'di ba? So, may limit rin ang autonomy natin. So, class, these bioethical principles are, I told you, class, black and white. I mean, there are black and white. There are gray areas when based on different circumstances. Yeah. So, class, yung mga quiz natin dito, syempre, it's about mga situational tayo. Okay. For non-maleficence, yan. So, maleficence, yung movie, class, maleficence means harm. When we say non-maleficence, it means do no harm, yan, or to do not cause pain, and do no harm. Class, the doctors, their primary responsibility is not to heal. Their primary responsibility is not to heal, but do no harm. Because at some point, class, your doctors will not be able to heal someone, but only lessen the pain, diba? Kasi some diseases are incurable. So, class, since some diseases are incurable, do not inflict more pain to the patient. Yan, above all, do no harm, sabi ni Hippocrates. Intention to avoid needless harm or injury that can arise through acts of commission or omission. So, class, some of our actions, example, medical technologies, in phlebotomy, class, tutusukin natin, yan. Class, it's inevitable that the patient would have bruises, yan, or needle marks on their arm, ganyan. They may experience fainting or syncope. So that is through the acts of commission due to our action, or omission due to negligence, class. Omission is negligence or not doing anything. Class, omission is not doing anything. So an example of non-maleficence, is negligence. Yan. So negligence is when you do something and you harm a patient. Yan. So example, class. A 50-year-old man collapses in the street. Yan. So, nag-collapse. So, before collapsing, he complained of severe acute pain in his right abdomen. A surgeon happens to be passing and examines the man, suspecting that he is on the brink of rupturing his appendix. Yan. The surgeon decides the best course of action is to remove the appendix in situ using his trusty penknife. Yan. So, may nag-collapse daw na guy. And apparently, luckily, a surgeon was passing by and he diagnosed that the appendix is about to rupture. Yan. So, the surgeon decides the best course is to remove the appendix on the spot, class, using a trusty penknife. Class, what's good and what's bad about this situation, diba? Good that a surgeon was willing to help, and he is so confident that he could do it. He could remove the appendix. Yan. That's good. Yan. The man is acting out of kindness. Yan. And prevents the harm of the ruptured appendix. Yan. But class, which is worst? Yan. So the bad side, class, is they are in the street. Yan. So in the street, so it's not a very sterile environment, ganyan. And he is only using a penknife. Is it sterile? And he does not have any anesthesia. So is that the best course of plan? Yan. So we need to balance beneficence, yan, the way we want to help others or benefit are promote the welfare of others, and maleficence, which is do no harm. Alin kaya ang magkakos ng more harm? Class, sabi sa inyo walang tama or mali eh. Ano kaya magkakos ng more harm dito? Pag inoperahan niya sa kalsada or pag hinayaan niya na wag munang operahan at hintayin muna na makapunta sa ospital. Yan. So, those are difficult decisions. Yan. Honestly, I don't know the answer. Yan. Buti hindi ako dyan. Wala ako sa posisyon na ganyan. So, how about you? Yan. Anong gagawin nyo kung kayo yung surgeon, diba? Next class. Your patient, Taylor, is a 12-year-old girl. So, dentist ka naman ngayon. Who competes in a beauty pageant. Her mother strongly wants you to do full veneers on her daughter to cover up her healthy but slightly discolored anterior teeth. You know that this is not a medically necessary procedure and could actually be harmful to the child. Yan. So, class, di ba yung mga artista, ang gaganda ng mga ngipin nila. Yan. So, perfectly shaped, perfectly colored, ganyan. So, what they do is they place veneer wherein they cover up your teeth with a brand new veneer, ganyan, veneer. Class, iba yung nakikita kong veneer is they shave your teeth off, tinatanggal yung white portion, tapos naglalagay ng bagong veneer or ng ngipin. So this is just, guys, a 12-year-old girl. Yan. Is this the best for our 12-year-old girl that she will get veneers for a pageant? Yan. And it is not a medically necessary procedure. It's for aesthetics. Yan. So, ano ba? Good ba or bad? Diba? Yan. Ito, class. So, issues. How is non-maleficence applied on withdrawing life support from a patient? Di ba nga ang concept, class, ng non-maleficence is do no harm. Do no harm. But in some cases, class, wherein the patient has been in life support for a very long time. Yan. So, at some point, the family is asking that to withdraw the life support. Ganyan. But actually, when you withdraw the life support, the patient will die. So, it will cause harm. So, ganun yung mga gray area na tinatanong sa non-maleficence. How about in cases of euthanasia and abortion? Yan. In abortion, abortion respects autonomy, but this respects non-maleficence. Euthanasia respects autonomy, but invalidates or disrespects non-maleficence. So, mga ganong issues. Okay. So, class, yun, principle of beneficence tayo. So, beneficence is when we promote the welfare of other people. Yan. We act out of benevolence, out of charity, out of kindness. Yan. We act to support others and hoping that our action will do more good than harm. Yun yung principle, class, ng beneficence. So, for non-maleficence, not to inflict evil or harm. Pero, class, your beneficence, class, is more, preventive eh. Sabi niya, prevent evil or harm. Remove anything that will harm the patient and promote good. Yan. So, class, yun, beneficence and maleficence should be hand in hand with each other. Yan. Ito kaya, class, basahin natin. A first-year medical student who wishes to get hands-on experience goes to Nicaragua and begins to diagnose and treat patients in an understaffed urban clinic with supervision. Class, the motivation of this first-year medical student is good because he wants to help people, diba? But class, he is just a first-year medical student. Only a first-year medical student. And actually, pwede na he or she is exploiting that the clinic is understaffed. Yan. And no one is supervising. So, might as well, class, might as well, mag-practice na ako ng ng skills ko. Yan. So, class, is this student doing more harm or doing more good? Diba? Ang ganon. So which is which ethical principles are applied here? Non-maleficence or beneficence? Yan. Yan. So number 1, parang do no harm kasi first year medical student pa lang siya. Okay, class. Wait lang, wait. Pause muna natin. Okay, charging. So guys, now we are here in your principle of justice. Yan, principle of justice. So class, sabi niya, we expect or demand to be treated justly. Yan, we want principle of justice is about fairness. Yan, to be treated justly. Yan, to have equal opportunities. Yan. So class, when it comes to principle of justice, so example nitong mga to, mahalaga siya sa accessing health insurance and your PhilHealth, guys, that your PhilHealth gives the people opportunity to pay, to not carry all the risk when they get sick. Yan. So your PhilHealth class spreads the risk. Example is it collects 300 every month to all contributors. Class, nagko-collect yung PhilHealth ng 300 pesos a month for all contributors. Then, those who are sick during the month of September, example, so yung pot of money during September will go to the people who are sick. Yan. So, maganda class talaga ang PhilHealth. Yan. Despite all the allegations. Next class, distribution of organs, distribution of the ventilators, distribution of limited resources. Who will get this? So, kasama yun sa principle of justice. Out of fairness, di ba? As much as possible, in the principle of justice, we want everyone to have the essential medicines that they need. But since here in the Philippines, we have scarce resources, we should prioritize, diba? We should prioritize who will get the medicine, or example, who will get the SAP, diba? Sino kukuha ng SAP? Siyempre, yung most disadvantaged, diba? Yun. So, class, mahalaga. So, justice is applied in your public health. Sabi niya, we should act in such a way as to bring out the greatest benefit and least harm. Yan. So, example, class, yung mga batas dapat natin, yung mga batas natin, that better ang batas kung mas marami ang makikinabang. Yan. Mas better ang isang batas kung mas marami ang makikinabang. So, class, here, yan, we have Declaration of Alma Ata in 1975. Class, in 1978, 1978, class, Declaration of Alma Ata of 1978. Class, noong 1978, all the leaders from different countries came together and decided and agreed that health is a human right. Yeah. Since health is a human right, so people who are dying because of preventable diseases, pag namamatay ang tao sa sakit na kaya namang ma-prevent in the first place, class, isa yung kawalan ng hustisya. Yan. That is a debasement. That is a violation of human right. Pag ang tao namatay sa isang sakit na pwede naman palang malimitahan in the first place. Yan. So, class, it's injustice. So, class, actually, it's the government's responsibility to provide the best health services as much as possible. Kasi nga, health is a human right. So, that is injustice. So, when just in the concept of justice, yan. So, dapat we prioritize the most disadvantaged, ganyan. So, as much as possible, we want to promote equality, meaning equality is everyone has equal opportunities. But if not, we also promote equity. Yan, equity, wherein we give more opportunity to the underprivileged. Yan. So, ganyan ang justice. It focuses on the greatest benefit. Yan. It focuses on looking the picture, parang mas broader yung tingin nitong justice eh. It's more on public health perspective. So, what laws to pass, yan. What services is to be implemented. So, something like that. So, class yan, no? PhilHealth. Class ito, this image, yan. May hustisya ba to wherein the wards are filled with people, wherein there are 2 or 3 people sharing one bed, diba? So, that's not justified. Yan. So, yan. Yan. So, class, we still have other terms. Yan. So, we have veracity. Maganda to, class. So, veracity is talking to your patients in honesty, with full honesty, telling the truth. Yan. Because class, telling the truth will foster trust in the relationship of a health worker and a patient. And class, it's very dangerous if a patient or a group of patients do not trust the healthcare system anymore. So it's very important that we are honest and truth-telling health workers. So class, veracity is under the umbrella of autonomy. Yan. We tell them the complete truth so that they can make well-informed decisions. Sasabihin natin yung totoo para yung decision nila is nasa tama. Yan. So class, an example. Yan. A 65-year-old man comes to the physicians with complaints of abdominal pain that is persistent but not extreme. Yan. Matagal na daw yung abdominal pain niya. A workup reveals that he has metastatic cancer of the pancreas. So, kumakalat na pala yung cancer, class. Malubhan na ang cancer. The man has just retired from a busy professional career, and he and his wife are about to leave on a round-the-world cruise that they've been planning for over a year. Should you tell him his diagnosis? Yan. Should you tell him his diagnosis? Kasi, class, pag sinabi mo yung, pag hindi mo sinabi yung diagnosis, if we are in the place of the doctor, if he did not tell the diagnosis, then the man will enjoy his vacation, diba? He will not worry about pancreas. They will just go on in their vacation. Yan. But class, if you did not tell your patient that he has cancer, yan. But if you did not tell him, he will enjoy yan. Walang worry. Pero pag sinabi mo, class, so it will hamper or it will ruin the vacation. Siyempre, nalaman niya na may cancer siya. Yan. So, which is best? Tell him or not? Yan. So, class, since we are learning about this one, so, dalawa na yung concept about this eh. It's about autonomy and veracity, telling the truth. Class, telling the truth to the 65-year-old man is beneficial. Why? Because since he has the complete and honest information, class, he can decide which one is really his priority. Since may metastatic cancer na siya at pwedeng may taning na yung buhay niya, perhaps he doesn't want to go on a world cruise anymore. Perhaps he wants to spend more time with his grandchildren, di ba? So pwedeng palitan niya yung priority niya, ganon. So marami rin, class, or perhaps he will go for chemotherapy. So class, telling the truth is very important. You should tell him his diagnosis. What else, class? Paternalism. Yan, huli na to sa bioethical principle. So, nagdagdag tayo ng dalawa, ha? So, veracity and paternalism. Paternalism are not the main bioethical principles, but we're just adding to our discussion. So, paternalism. Yan, paternal. Yan, father as in father. Acting fatherly to someone. So, class, when you are a father, ganyan. So, when you act like a father, but you assume the best interest for your children, ganun. You assume the best interest. You think that they could not decide well for themselves, kaya you decide for them, that you know what's best for them, to protect them. So, parang ganun yung motivation ng paternalism. Yan. So, examples of acting paternalistic is some preschools do not allow children who were not vaccinated to enroll. Totoo yan, class. Some preschools do not allow children who were not vaccinated to enroll. What else? Government requires the people to contribute to the pension system or to SSS. Yan. Not selling of drugs. Yan. To putting on, ano ba yun? Sorry, narami ko typo. Class, so yung government, sinasabi niya, wag tayo gumamit ng drugs, wag tayo magbenta. Sabi ng government, mag-seatbelt, ganyan. So, they are acting in a position of caring. Yan. Because, pag nag-sell tayo ng drugs, ganyan, pwede din tayong gumamit ng drugs, ganyan. Or, pag di tayo gumamit ng seatbelt, pwede tayong maaksidente. So, class, in paternalism, we actually undermine autonomy. We undermine. Ibig sabihin, we do not act in autonomy. So, we do not respect the autonomy of the person. Kasi ito, kunyari, di ba sabi ko nga, yung mga anti-vaxxers, we respect that they do not vaccinate their children because of autonomy. Pero, class, some preschools, these preschools are acting paternalistic. So, ibig sabihin, they care for other children as well. Kasi kung may isang batang hindi na bakunahan, pwedeng magka-measles tong batang to at hawaan yung ibang bata. So, they are acting according to the best interest of the people. Example, class. Yan. So, the case of Dax Coward. So, Dax Coward was severely injured after a gas explosion. And he acquired third-degree burns. Grabe. Na-try ko ng makaamoy, class, ng pasyenteng may third-degree burn yan. Na kuryente siya. Class, ang baho. Tapos, yan, try googling it. Yan, ito na yung pinaka-less na gore na photo na nakita ko. So, class, sabi niya, after that incident, when Cowart was first taken to the hospital, he demanded the clinicians to let him die. Yan. So, sobrang tindi ng mga sugat na kanyang natamo during that gas explosion. Yan, he wants to die. However, yan, yung mga burn unit doctors, they acted paternalistic, sabi nila. They told White that Cowart was irrational, yung psychologist niya ata si White, and depressed and needed to be declared incompetent so his mother could be appointed his legal guardians. Itong mga burnt unit doctors na to, hindi sila pumapayag sa sinasabi ni Cowart na gusto na lang niyang mamatay. Yan. So, hindi nila nirespeto ang autonomy ni Cowart. Yan. Sabi niya, kumuha sila ng psychologist, sabihin nyo, irrational na siya, depressed na siya, i-declare nyo na siyang incompetent para yung mother na lang niya ang mag-decide para sa kanya. Yan. So, that was the issue. Yan, totoo to That was the issue that they have to handle. And however, class, so unlike the doctors in the burnt unit, the surgeons refused to operate unless Cowart gave informed consent or was declared legally incompetent. Itong mga surgeons naman to, they are very to the book talaga. Sabi nila, unless kung may informed consent si Cowart, mag-oopera kami. Or pag dineclare siyang legally incompetent at inalaw na yung mom niya na maging legal guardian, doon lang kami mag-ooperate yan. So, they're very to the book, talagang fina-follow nila yung informed consent, yung autonomy, or yung hinintay nila yung sinasabi ng korte bago mag-opera. But class, the ending was yan. Cowart eventually agreed for the medical intervention. So class, next is your professional code of ethics. Professional code of ethics. Actually, you can read it down. Pwede nyo nang basahin yung professional code of ethics of medical technology on your own time. You don't need to watch this video, but you know, class, explain ko isa-isa per line, why not? Yan. So why do we have professional code of ethics? Class, so bakit may code of ethics ang mga medtech? Yan. Bakit may code of ethics ang mga engineers? Yan. Why? Number one, it defines the privileges, behaviors, and responsibilities of a professional. Class, to be holding a license, yan, to be holding a license to be able to practice medical technology. Class, it has privileges, yan. So, isa kang professional, yan, mas mataas sweldo mo, of course, sa mga, compared sa mga non-professionals or sa mga non-licensed. It has privileges, but you should act in such a way that is professional, that you have responsibilities. Though we have privileges, we also have responsibilities. Number two, promotes high standards of professionalism, conduct, and morality. Three, defend the professional from interference from different agencies. Number four, ito, preserves the dignity of the professions and the profession and the confidence of the public. Class, having a code of ethics, this is our guide, yan, of what to do, of not what to do, yan, to maintain the integrity of medical technologies. So people will still have confidence among medical technologies. Dapat we should have limits with our actions, or we have boundaries in what we are doing. Yan. So to us to protect the name of medical technologists, yan, that we are professionals. Yan. So class, may mga kakilala na ako, class, na nawala yung lisensya nila because they broke the code of ethics. Yan. So let's explore what is inside the medtech code of ethics. So class, so I got my license. Once you pass the board exam, so makukuha mo na yung license mo. Tapos class, you will have a oath-taking ceremony. Yun, magkakaroon ng oath-taking ceremony wherein, so you will say this code of ethics. Yan, you will say it in front of a board examiner. Yan. So, tatlo ang board examiner natin. So, there are 3 people who are making the board exam. Yan, tatlong board examiner. So, yung isa doon, class, pumunta dito sa Baguio at sa harap niya, doon kami nanumpa. Yan. So, class, explore natin. Ako, ganda-ganda ng Board of Medical Technology Code of Ethics yan. Let's read it together. Okay? So, as I enter into the practice of medical technology, yeah. So, as you begin your profession, I shall accept the responsibilities inherent to being a professional. You should conduct yourself as a professional. Yan. So, hindi ka na lang, ngayon, putyo-putyo, isa ka ng professional. I shall uphold the law and shall not engage in illegal work nor cooperate with anyone so engaged. Yan. I shall avoid associating or being identified with any enterprise of questionable character. Class, hindi ka na pwede gumawa ng mga illegal na bagay. Yan. Class, when I was in college, and my friends, my medtech friends, we are talking. Class, may time na uso ang mga underground drug laboratory. Nung panahon namin, class, we were joking that we will make one day an underground drug laboratory. Yan, class, may time kasi uso nun. Ngayon, parang hindi na uso yun. So, class, ganun yung mga kwento-kwentuhan namin. So, class, we cannot, after knowing this, hindi tayo pwedeng gumawa na ng illegal or associate with other people who are doing crime. Class, ewan ko kung kilala nyo to, yung pork barrel queen, yung class, yung nakulong dahil ang rami-rami na daw nakuhang pork barrel. Class, yung whistleblower niya, kaya siya nahuli is Ben-Hur Uy. So Ben-Hur actually is a medical technologist. Yan. And he was a whistleblower of that pork barrel queen. Nakalimutan ko na yung pangalan ni pork barrel queen. Ayun class, yan actually Ben-Hur was associating or being identified with any enterprise or questionable character. Yan. So class, don't do it. Yan. If you know someone who is doing something illegal, yan, don't associate with them. Galing no, class. What else? I shall work and act in a strict spirit of fairness. Yan. To employer, clients, contractors, and employee, walang favoritism, walang bias, in a spirit of personal helpfulness and fraternity. Yan. So since we are, class, diba meron kasi yung mga taong yung very competitive, yan, they can be not acting very fairly, yan, to their colleagues, yan, to their bosses, blackmail, ganon, para makaangat, diba? What else? I shall use only honorable means of competition. Yan. Some are not using honorable means of competition for professional employment or services. I shall refrain from unfairly injuring or directly or indirectly the professional reputation of projects or businesses of a fellow medical technologist. Yan. So class, we should act professionally. Na kunyari, hindi tayo magkakalat ng chismis na may HIV si ganyan or positive sa drug test si ganyan, di ba? So, let's not destroy someone's professional reputation. Yan. Kasi no? Malinaw, clearly stipulated sa batas natin. So, example class, I worked in a hospital, ganyan. And that hospital class, it did not pay me well. Yan. Pero class, I'm not in the right na siraan yung hospital na yon. Yan. Class, kunyari, example, umalis na ako sa UB class, I'm not in any position to ruin the reputation of University of Baguio. So, once I did that, so I'll be breaking the code of ethics. So class, ayun nga, ang tawag dun pala, naalala ko lang. I shall uphold the law and shall not engage in illegal work. Yan. So class, yun nga, meron na akong kakilala na tanggalan ng lisensya due to adultery. Adultery class. Nareklamo siya ng asawa sa PRC, Professional Regulatory Commission. Tatanggal ang lisensya dahil sa adultery. Okay, what else? Yes, I shall accept employment from more than one employer only when there is no conflict of interest. Yan. So class, if you're a full-time teacher in UB, you cannot teach in UC. But if I'm not a full-time teacher in UP, I can teach in UC. There's no conflict of interest. Yeah. So I shall perform professional work in a manner that merits full confidence, trust carried out with absolute reliability, accuracy, fairness, and honesty. Class, if you did not perform a test well, you're not confident, then just don't release your results, period. Yan. If you're not honest with your results, just don't release it. Yan, trust me. Next, I shall review the professional work of other medical technologies. Yan. So, let's move the profession forward. Tulungan mo yung mga kapwa medical technologies. I-peer review mo yung research nila. Yan. Tapos, yan. Review the professional work. Galing, no? But else, I shall accept employment. I shall advance the profession by exchanging general information. Class, kung may seminar, i-share ko sa'yo, ganon. Class, let's join professional organizations. Class, ako, part ako ng PAMED, Baguio, Benguet, Mountain Province Chapter. Yan, actually, officer ako doon. So, yun, class, we make contest. Yan, may pa-TikTok contest kami. Sana sumali kayo. Yan, I will post this week. I'll post it this week. I shall restrict my praises, criticisms, views, and and opinions within constructive limits. Yan. So, wag wag maging sip-sip. Yan. Shall restrict my praises and criticisms, views, and opinions within constructive limits. Something that will improve a person and will not put down a person or of bad motivation, yung yung or bad intention, yung intention mo hindi good. I shall treat any information I acquired about the individuals in the course of my work as strictly confidential. So that is autonomy. You respect them. You respect if they want to keep their information private. Yan. So unless they allow you to disclose the information to the relatives, then do so. Kung hindi, wag mo i-disclose to anyone. Yan. Next, I shall report any infractions of these principles of professional conduct to the authorities. I-report mo. Yan. Wag itulfo, i-report mo sa tamang kinauukulan. And finally, class, ito yung final words ng Code of Ethics. Ang ganda-ganda. To these principles, I hereby subscribe and pledge to conduct myself at all times in a manner befitting the dignity of my profession. Yan. Kung hindi mo naalala yung iba, yan, yung final words, sabi niya, I will conduct myself at all times in a manner befitting the dignity of my profession. Class, kahit nasa bahay lang ako, we're online class, yan, I'm at home, I'm outside, yan, my actions should reflect that I am a professional medical technologist, yan, that I am honorable, yan, that I am honest, that I have integrity. Yan nga yung sinasabi ko sa inyo class. Who are you when no one's watching? Yan, sino ka ba talaga? Yan. Itong teacher nyo, magtuturo pa rin ba kayo ng maayos? Even though no one would ever watch this video lecture. Yan. So class, I hope that you would reflect on this code of ethics. Ang ganda-ganda. So this is our direction on how to act as a medical technologist. Ang ganda-ganda. So class, thank you for listening. I appreciate it. So I'll see you again next time. Okay.